Today I'm joined by Carlos Texador. Carlos is the CEO of Bridgeway Recovery Services, which is right next door to the Men's Mission in downtown Salem, across from the police department. So a fantastic opportunity to work closely together in serving folks with needs, particularly addiction needs. So again, my name is Dan Clem. I'm CEO of Union Gospel Mission, and Carlos is CEO of Bridgeway. So
That's right.
Carlos,
Yes.
welcome.
Thank you for having me and for the invitation.
Yeah, you've been there now for how long?
About 2 weeks, a week and so. So hot off the press. So.
Yeah, the fire hose is
Yes.
still, yeah. Well, what a blessing to meet Carlos. I met him a couple of weeks ago and just wanted to share and celebrate how we have partnered in serving particularly men with addiction recovery services. So with that, Carlos, let me ask you a couple questions.
Shoot.
What's your story?
Oh, wow. I don't think we have enough time, Dan. I appreciate
We got
that.
a half hour, but yeah, please.
So in terms of what my passion is for helping our community and my role with Bridgeway is I have lived experience with substance use and just having some hardship, and challenges while, during my upbringing. And that's kind of where it birthed would help shape my and give purpose to my mission in life. So I've been a counselor in substance use disorder, mental health, and overall behavioral health since 1999.
Oh, wow.
Let's not do the math.
No.
That would get that's quite a few years.
Started when you were in grade school.
Yeah,
obviously.
that sounds about right. I was 12 or something, maybe.
Yeah.
But what kind of set the environment is a lot of dysfunction in the home, a lot of substance use within my family of origin, and I also, due to my choices, I ended up spending some time in the Department of Corrections. And honestly, when I transitioned from being incarcerated, I found myself not having the necessary support, and I found myself not necessarily in the condition that some of our community members find themselves, being unhoused and unsheltered, but I was literally just sleeping on the floor for some time. So
wow.
I had somewhat of a safety net, but I understand that it can be challenging when you don't have a roof over your head. A lot of our clinicians and have lived experience and understand some of the challenges with substance use and unhoused, unsheltered folks experience. Sure. They have lived it themselves. So we really have a compassion for helping our community members, because it's not us and them, it's us helping each other. And a lot of us have experienced that. So we come with an open heart and a giving heart to empower individuals. And we understand that it's not about addressing one thing or another, but it's addressing the individual holistically.
Everything.
And addressing the social determinants of health, with it impacts education, housing, and a number of other things. So for Bridgeway, what we have done is really move towards integrated care, and in terms of delivery of care to address not only homelessness, but substance use disorder and mental health disorder. We understand the intersectionality between those things. So we provide one of the largest spectrums of care in Oregon. That means that if somebody just is wondering if they have a problem, we could provide some psychoeducation. This is what it looks like. This is how it could impact you. If somebody needs a greater level of care,
right,
we could, provide additional levels of care. And I won't bore you with the jargon, but then if somebody needs really intensive, we provide what is known as medically managed withdrawal, which is our detox, commonly known as detox, one of the few providers in Oregon. So we get individuals from across our state coming to Bridgeway to detox.
Wow.
And then after individual detox, what next? So what we try to do is they're local, provide them with residential which is about 4 to 6 weeks. It can be a little longer.
Sure.
So it's residential, and that's a level 3.1, where individuals really provides that additional respite to equip them with the skills to manage life differently and develop that resilience and how to navigate life now without substances. And then after they get out of residential, they could go into outpatient services where they will work with a counselor and a mentor to help, again, strengthen and navigate the challenges of what now.
Right.
What do I do with my life now?
What next?
And for us, it's providing stabilization housing. We have, for women right now, we're looking for amends. We also have our new options apartment, where it's intermediate transitional housing that we help, because we recognize the significance and importance of housing for individuals in recovery.
Right.
So I know that's a whole lot to unpack, but at least I try to keep the jargon out of it and give you a quick there's many other services, but I think this is important. Recognizing that some individuals have not had medical care. We have our medical clinics. So if somebody comes to us and they don't have a medical provider, a primary care provider, we provide one for them, and it also helps with prescription medication, especially if they had psychiatric needs.
Right.
We could provide that and prescribe medications for the individuals struggling with mental health disorders.
Sure. I'm kind of overwhelmed by all that you do, but
I was trying to squeeze it in our time, but
no, but I got it. You piqued some curiosity in that medically managed withdrawal, what commonly is known as detox, which is, just give us an update on what that building construction thing is right on your campus.
Yeah, and great question. I think that just to expand that a little bit, anybody could detox from their home or just anywhere. Yeah, anywhere. So I think what distinguishes medically managed withdrawal is that you have 24-hour nursing staff to help with certain forms of withdrawals. It could really be not only uncomfortable, but risk of even death. So it has a medical component to help individuals detox comfortably, which it could be even detrimental to their health and their well-being if they're not. So there's a difference between just detoxing and going cold turkey, and then medically managed withdrawals, where you help individuals, titrate or come off the substances with support, medical support.
Sure.
And that's 24-hour nursing. Currently, we have 24 beds available, and that's the census stayed pretty high because there's a huge need in our community, not just in our local community, but across the state. So our goal is to, with the new property and the construction on Front Street, is to expand that capacity to around 47.
Wow. And so we at the Men's Mission provide what I could refer to as outpatient detox services, and if somebody needs more, it's a 4-minute walk to your front door.
Absolutely.
And so only God can put stuff like this together, because it wasn't really planned to do that. But in that sense, we share clients and guests. And we coordinate. I know our staffs coordinate quite a bit, because it's about that person. It's not who or where they go, but it's about where they're at in the whole continuum of healing.
Absolutely.
One of the things that you said rang true in a statement we had earlier this morning is we're in the healing process. We're wanting to explore through our faith ways to have fun again without using substances. We tend to think of, you just detox and then you're fine. And the reality of it, you've got life to live. And us, we know that Christ is the transformer of lives, but together we help make sure that there's not an exit plan, but a next ramp plan, how to have fun, get established with employment, housing, counseling, that continues. And so as Bridgeway has expanded I understand some of the beds are for stabilization, some of them are for medically managed detox.
Yeah. So yes, and for our new building and our medically managed withdrawals, some of them will be sobering beds.
Sobering beds. That's the word.
I got you.
Yeah, we got it.
I got you.
Okay. Yeah,
So there'll be
thank you.
sobering beds. So let's say somebody is currently they get stopped or detained by our law enforcement and they're
Right.
visibly intoxicated. For their safety, law enforcement could say, hey, let's get you to the sobering station. And that person has 24 hours to just rest and be
Right.
safe rather than in the elements.
Right.
If they choose, they could then transition into detox if they need it, or be go on about their day if that's what they choose. But
Yeah.
it'll be easier for our community members to like get sober,
Right.
rather than on the side of the road on the streets.
And it's they have to want to go to the
Absolutely.
sobering. Nothing's mandatory.
Correct. Even if law enforcement brings them, then they're not required. We're not
Sure.
going to mandate anybody to sober up, but it's just for safety reasons.
For about 8 years ago, the sobering center was contemplated with the city of Salem, and law enforcement peace officers
Yes.
were excited about that because I got this guy, in bad shape. Where do I take him? The ER room is overwhelmed.
Correct.
And quite frankly, if they're sort of inebriated, the ER room doesn't want them either because
Correct.
they're trying to treat people who are in a greater crisis, put it that way. So I think that sobering center will be or the sobering rooms that will
Yeah.
be part of medically managed detox is going to be a huge way for us to let folks stabilize, and then whatever is next for them. But like, we're 5 minutes away. So
Absolutely.
we'd love to be able to not only serve the same clients and guests, but as that sobering center settles them down, gets them back to a more lucid state, we're going to be right there.
That's amazing.
So again, only God can do this. We
Yes,
can't plan this.
yes.
But, so when you Bridgeway has a number of services that they provide.
Correct.
I don't even remember, but if you could share some of the other services that.
Yes. So one of the I think important pieces is to recognize that as much as we want to service individuals and care for them, some of it is after the fact.
Oh,
So what we have done is we provide adolescent services for youth and families from like 14, those teenage years.
yeah.
But we also have partnered with Salem Kaiser School District, and we're in 20 of the middle schools and high schools, including online programs that they have, where our counselors, our clinicians, go into the school and do early intervention with youth that have been found, let's say, smoking in the boys' room, or caught with paraphernalia. So rather than expel youth and then they're missing school, we provide early intervention, so they're not only remaining in school, but also receiving some additional supports and exploring before things get way out of hand.
Yeah.
So I think catching things early, upstream, I think that's important. And we collaborate also with other counselors in the schools and family members and behavioral specialists. So it's a collaborative effort within the schools to prevent things from, individuals struggling later on in life. We also refer to other community departments like Children's Behavioral Health, Charlie Health, which is online intensive outpatient for mental health. So we're not trying to do it all ourselves, but mobilize the resources in our community.
Yeah.
So that's with the youth. We also partner up with the juvenile department to provide services with individuals, kids that are in the GAP, Guaranteed Attendance Program. We do assessments in detention. So we really are integrated into a lot of the services. Moving with young adults, and we do have the Bridgeway Community Connect, which is a low barrier access under the Behavioral Resource Network. And historically, what would happen, we could only service individuals that will walk through our door, our threshold, and ask for help.
Sure.
And if they met criteria, diagnostic criteria, then we could enroll them in services. With the Behavioral Resource Network, funded under Measure 110, it created low barrier access. So now we have navigators and care coordinators, such as certified alcohol and drug counselors and mental health counselors, qualified, that go into the community and able to connect and help individuals with no strings attached. So if they need help, we could help them, whether they choose to be our clients or not.
Right.
And if they want to work with another provider, we connect them with different providers, whether it be Marion County Health and Human Services or other partners in their community that are also part of the resource network and may not even be a part of our network.
Right.
But it's just helping individuals get the care they need. The type of service that we offer is somebody needs food box. We help them connect with the resources. We have individuals trained and connect with employment specialists. Mm-hmm. We also help individuals that are trying to activate or get enrolled in SSI or SSD, Social Security Services. I better clarify my acronyms.
Yeah.
So just really we offer an assessment within 24 hours if they choose.
Sure.
If they do want, say, hey, I do want help, we could do an assessment and then refer to the appropriate level of care that they are requiring or needing or wanting.
So gambling, there's some other things out there?
Yeah, you got me as well. So we also provide services for problem gambling. And I think Bridgeway has been kind of like a pioneer for many years. In the state of Oregon as a whole, has been done a number of research about problem gambling. And for many years, our Sandy M House was one of 3 in the nation of residential program for problem gambling.
Really?
Yeah, now it's one of 5.
Oh.
So it's still, a short number.
Yeah.
There's only a handful of states that are providing residential. So Bridgeway is the only one in the state that provides residential problem gambling. So we have a number of clinicians that provide outpatient problem gambling and residential problem gambling.
So in all these different areas of help, I mean, they all kind of come together lots of times too. Sort of not a comorbidity, but a collateral.
Yeah.
So if this person walks in with problem X,
Correct.
you lots of times discover that there's other issues.
Absolutely. And you're right. I think that's a common use term, comorbidity. Now is most really referred as integrated.
Integrated,
co-occurring disorders.
Okay. Co-occurring.
Yeah.
All right, I'm getting
it's all right.
educated
It's
here.
all right. Well, hey, you get a gold star. So yes, and we want our clinicians to be trained in as qualified mental health professionals, practitioners, qualified mental health associates, as certified alcohol and drug counselors, a certified gambling and addiction counselor, and our peer support specialists or mentor or traditional also train in integrated co-occurring. So it's our expectation in Bridgeway that our staff, and we're recognized by Oregon Health Authority as one of the providers for integrated care.
Sure.
So I think for us it's important because we want to have or practice no wrong door. So if somebody comes to our services and they come here, it's like, oh, this is not the right door. No, let me connect you with the right door.
Sure.
So and speaking of residential services, we have 4 residential service houses for substance use disorder.
Okay.
2 for women and 2 for men.
2 for men. Wow.
Yeah.
Well, and I just want to say thank you to your staff particularly because they do a lot of interaction with our staff, and men and women, and we're part of one of your solution places for people needing residential or needing more outpatient, because we have medical clinics as well. But I think the exciting piece is you guys are just partnering in so many different areas. So I want to get to that word that I really like, network.
Yes.
I mean, no one agency can do it. Lots of times it takes UGM and a couple of agencies such as Bridgeway to combat addictions.
Absolutely.
Treatment. We do addictions counseling, but you guys are doing addictions treatment and then detox. So I think I just want to make sure we all understand that we're locked arms. We're not duplicating.
Correct.
We're locking arms with each other to serve, and each person's different. Every story is different. God made us all different.
Absolutely.
And every one of us has a different thumbprint. That I'm thumb buddy here. So that's kind of a joke. Anyway, yeah. And you're local. I mean, you grew up here. You went to college here.
That's correct. I'm originally from Puerto Rico.
Okay.
I lived in the Bronx, New York for a while, but I've been in the community since '89. So yes, I think that's enough to consider myself local.
Yeah, well, it's great having you here, and
Yes.
it's I sure appreciate the partnership that we have with you, and look to see for success. Ribbon cutting at the medically management treatment facility, withdrawal facility with sobering beds.
Yes, and our medical clinics.
And a medical
so
clinic.
I think overall, I think it'll fall under the medical clinic banner. But yes, we are super excited. And I think this is what our goal will be to open January of 2026.
Okay. All right.
So
it's just right around the corner.
just right, like a year.
Yeah.
So
it flies.
our hope and our goal is to open in a year.